quality without boundaries. You might wonder why we have chosen this topic. So, in order to give a perspective, as you are all aware, healthcare in today's times has become synonymous with quality. So, and we often wonder, how do we measure that? This is where quality accreditation comes in. It is a indicator of the services one provides and the value the organization imbibes from it. So, some of the benefits include enhanced patient safety, improved clinical outcomes, increased patient confidence, compliance with regulatory requirements, reputation, and market differentiation. I am Dr. Rajat Hazra from Practo, heading the medical content team, and here with me is a distinguished guest, Dr. B.K. Rana, who's the CEO of Quality Accreditation Institute, QAI. Prior to the current assignment, he was Director, CEO in charge of NABH, Quality Council of India. He is elected on the Board of Directors of International Society for Telemedicine and e-health for a 3-year term starting from 2022. He's also a part of various committees like the Technical Committee of Ayurveda Training Accreditation Board, Ministry of Ayush. He's also team leader for International Accreditation Program of ISQAA. He is an international consultant and expert for the World Health Organization, World Bank, Asian Development Bank, and numerous others. He holds to his honor 12 at least 12 research papers in various international journals. He has contributed chapters in books and presented in several national and international conferences. His passion for doing different things differently keeps him motivated to innovate and create new standards and programs. So I pass the stage to you, Dr. Rana.
Thank you. Thank you, Dr. Rajat. Thank you very much for thank you, Practo team, for having me here today, this afternoon. And I think the topic is well selected. The healthcare without boundaries, or, there are many things which keeps uh, flagging off in healthcare in last couple of days, particularly after pandemic, COVID-19. And COVID-19, unfortunate situation. However, it has taught many lessons to us in healthcare, particularly in India, as far as medicine is concerned. As all of us know that telemedicine was not actually a legal framework prior to March 2020. But after COVID, that at that time, Medical Council of India, currently NMC, National Medical Commission, has actually published telemedicine practice guidelines in March 2020, making it that doctors can practice. So it was actually, these are for individual registered medical practitioners, not only in medical allopathic medicine, but in all Indian system of medicine, whether it's Ayurveda, homeopathy, Unani, all these council have published their TPGs, telemedicine practice guidelines to be practiced. Now, in these guidelines, there is also a mention of telehealth platforms, the technology platforms which are used for providing telehealth services. And there are certain requirements also put in there. So we learned something out of those and thought to have a standard for accreditation on telehealth services, because it's now it was at that time was gaining momentum, and of course in last 3 years it has really gone up, not only India but many parts of the world, and even in United States it has been extended for two more years, even after pandemic period over. And I think in India also it is picking up again, and people are choosing to go for telehealth services, teleconsultations, uh, and therefore it's become very important that we should continue talking about it. Uh, unless we have a dialogue, we have a conversation about practices, about standards, about benchmarks, we would not reach anywhere. We will just simply talking about. So it's very, very important that we really continue our conversation around telehealth services, telemedicine practices, and also discuss that how we can make sure at the end of the day the patient is safe. Uh, it's not easy to keep things up, but we should continue trying uh, to achieve that. So just allow me to share my couple of slides for this session, uh, giving you some of the perspectives of QAI, what we are doing, who we are, and then about telehealth services standards, not detailed, but a framework, the outline of those, and then why we should have it, what are the importance of accreditation in telehealth services, some challenges and opportunities, and lastly, but not least, but about accreditation process. So QAI, Quality and Accreditation Institute, actually a very young organization, started out 2017 with a vision of nurturing the largest global pool of organizations and people through quality improvement and accreditation framework. So quality improvement and accreditation is at the core of our vision statement. And we have a mission to achieve our vision. And mission is to conceive and deliver education, training, accreditation, and related programs in partnership with stakeholders using an approach of co-design and co-creation. So we really built on designing and creating things together. It's not in isolation, be it a single organization, but we want to take everyone together. And that's why this our mission is in actually sync with vision. If we want to create a pool of organizations and people, then we have to really take them together. And that's why using the approach of co-designing and co-creating. So we work together with individual professionals, organizations to develop our programs based on values of a good listener, competitive in the market, transparency in our operations, and continuously innovate to improve and design new things. So as I mentioned, we started off in 2017. We developed 14 sets of accreditation standard in 5 years, and which we makes a statement based on is that we are the fastest developing accreditation body in the world. We have four verticals. Center for Education and Training is actually focused on delivering different types of educational tools and training based on accreditation standards, as well as a topic of general interest, as well as tailor-made programs based on the requirements of any stakeholder. Last vertical, Center for Accreditation of Veterinary Facilities, a unique vertical again, which is yet to take off in practice, but we have already developed the standard accreditation standards for veterinary hospitals and veterinary clinics, and these have been supported by Department of Animal Husbandry and Dairy, Government of India. So we are just about to kick off these programs. We have Center for Laboratory Accreditation and the Center for Accreditation of Health and Social Care, two major verticals for driving our accreditation and quality improvement. We also set an office in Canada in the name of QI International, thinking that we can also operate from that part of the world to serve that part of globe. For health and social care programs, we offer an end-to-end solution, starting from a clinic to ambulatory care, covering any daycare type of activities, to a tertiary care hospital. And then we also cover home health care, transition care, which are inpatient rehabilitation centers or de-addiction center, senior care, or assisted living, or palliative care, different types of activities covered under transition care standards. We have telehealth, of course, as we are talking about. We have hotels and homestays accreditation standards. We have a specific standard for dialysis, for assisted reproductive technology like IVF. So this was our first disease-specific accreditation program. Then we are again develop a specific program for emergency department, a green healthcare facility to support a sustainable development globally, working towards greener healthcare and healthcare resilience and sustainability to support the environment. Then we have a patient safety certification program based on WHO standards for patient safety. And then last but not least, we have developed the second disease-specific accreditation standards for primary and advanced stroke centers. So these are our menu for different healthcare verticals, providing different accreditation standards for different types of healthcare facilities. We also the first accreditation body in India achieving ISCO accreditation in less than 5 years of operations. We have three standards: dialysis, home, and hospital standards accredited by ISCO, making us one and only accreditation body in India. No other accreditation body in India has achieved this. Our accreditation program are recognized by Ministry of Health, Central Government Health Scheme, CGHS, for empaneling hospitals and dental centers, eye centers, and imaging centers. For laboratory accreditation, we provide 5 programs. 4 are based on ISO standard ISO 17025 for testing laboratories and calibration laboratories, ISO 15189 for medical laboratories. We also provide a certification program based on Clinical Establishment Act requirement for medical labs. And there is a new program for biobanking accreditation based on ISO 20387. Very unique, a new program. We are the first and only accreditation body in India at the moment providing this accreditation. And we started off in 2021. When we started in 2021, we were the third accreditation body in all of Asia Pacific after US and China. We are again for our laboratory vertical also, we are internationally recognized by Asia Pacific Accreditation Cooperation full member and MRA signatory status, as well as International Laboratory Accreditation Cooperation, making us part not only equivalent to our national body NABL, but any other accreditation body anywhere in the world. So we are a global in that. So which means that laboratories reports accredited by us, uh, they are acceptable anywhere in the world. We are institutional member of International Society for Quality in Healthcare ISCO, and also on the board of directors of International Society for Telemedicine and e-health. See, this ISFTS we joined in 2021 when we developed telehealth standard to see what is something specific. And then in 6 months of joining, we got elected to the board of directors. And now QA is leading organization in ISFTS to guide them in different fields, including a telehealth accreditation program. So last week I was made a chair of a working group in ISFTS to drive how we can really leverage on accreditation of telehealth services by different provider, whether it's QAI, JCI, or URAC, or any other providers globally. We run a journal, QAI Journal for Healthcare Quality and Patient Safety. It's a peer-reviewed journal, 2 issues in a year, free online, free downloadable for anyone who's interested, free submission of articles, no charge for authors. So anybody interested definitely would like to consider this. This is our gold seal, mark of sustained quality. Accredited facilities become entitled to use this mark to demonstrate their commitment to quality and safety. Uh, Coming to the second part of my presentation about telehealth accreditation standard, uh, is a framework of different requirements put together in 10 chapters, which have been further divided into 61 standards and 239 criteria. So these 239 criteria are measurable criteria. They can be measured, and compliance to the criterion makes compliance to the standards, and complying to 61 standards, complying to 10 chapters. So in all, when we meet 61 standards, we meet the entire framework for accreditation. And how this is distributed across as a framework. So as you see on this screen, there are 10 chapters, as I just mentioned, uh, starting from governance and leadership, which means that how the governance is moving around organization, what is the leadership, how the leadership is functioning, and what are the roles given to leadership in defining quality and safety protocols. Uh, what are the things which the governing board or entity is actually driving as an agenda for quality and safety? Because until unless it comes from the top, it won't work. So it's given a lot of emphasis on the governance and the governance structure, the governing rules, and the leadership functioning to drive the agenda for quality, safety, telehealth services through 6 standards and 18 criteria. The next comes human resource management, and it talks about the whole range of activity of human resource management, starting from defining what you need, how many you need, and how you will get them. So you have to do a cause analysis. You have to do a need assessment of your human resources. That how many people you need and what type of background you need in them, any specific skills you are looking for. So you have to define all these things, and then it starts after you define. Then you start from onboarding how you get them. So your recruitment process, your selection process, and once you get them, how you make sure they are continually complying to the requirement of your skills, your competence. So you define performance improvement, performance measurement, or annual performance procedures, or also the continuous professional development on an ongoing basis. And then any system for handling any complaint and grievance out of any of your staff or any personnel in the organization. So it's whole starting from a recruitment to continual improvement, all those steps are taken care of. Then comes to facility and risk management. This is very special because if you are a hospital-based telehealth provider, you have a whole facility, you have a hospital, you have a place. If you are a platform for telehealth, then there may be two types. It can be just completely virtual, no nothing in existence in physical form. The cloud server, you know, everything on cloud, everyone is on remote, virtually existing. It may be for a platform, maybe a facility also, where they are having a couple of staffs to manage some of the equipment which you might be using for delivering telehealth services. You may be having physical server if you're not all on cloud. So you may have all these things. So if in case you have there's a physical facility, then how you have to make sure that that is safe for everyone there, and how you manage the risk if there are any. An information management system is one of the most critical aspects of telehealth services standard because it's all about information. And it is existing, and when we say telehealth, it's existing basically paperless. It may be some paper component if somebody choose to write a prescription on paper, then scan it or take a copy, a photo, and then putting into the system and to transmit it. If you are not doing that physical prescription, then almost everything is electronic. So it's very important how you collect information, how you store information, how you retrieve information when you need it, and how you make sure the information which you collect remain confidential from all the everyone, and is safe also. Nobody should be able to access without proper authorization. And then how you discard the information when you're no longer requiring it. So it's all about your information management system. Then continual quality improvement is a driving chapter for all the nine other chapters in terms of defining your own performance indicators, performance measures. Performance may be clinical and maybe non-clinical, which are managerial in nature. It can be patient satisfaction, it can be staff satisfaction, it can be a turnaround time for different procedures or processes you are engaged in. So you define your things, and build on that your performance improvement processes to check whether you are improving. So you need to check it, monitor it on an ongoing basis to make sure that your processes are improving, and so the services. Then patient assessment and care, and this is the first chapter where the patient comes into to play. So once patient is intending to seek a telehealth services from a provider, you get in touch with a provider through different media available, whether it's a telephone, it's a WhatsApp, or it's any electronic tool or a website, anything based on availability. So once the patient get into it, then of course there is maybe a registration process, that how you register the patient, how what information you capture, again, even before you take it to the doctor for consultation, and any fees payment or anything what is there. So once get into the provider, the consultant, then how the consultant assess the patient. Patient is remote, okay? Is it remote? So how you assess patient? Are you using any tool or technology or a device to assess, or you are just assessing patient based on a verbal communication over telephone or over mobile phone or a landline or a website based system or a web based system, whatever system is existing and being used by the patient. So patient assessment is done, certain things need to be captured, then a care plan is to be prepared, and then the following things happen. And then patient rights and education, of course, whether patient comes in physical presence or in a virtual, patient rights holds good every time. So you need to list out patient rights, make them available to patients information that uses on your website if you're a platform, or even for a hospital-based telehealth platform, you have to make them available to the patients. And then education. So education plays a very important role, and particularly in telehealth, because you are not in physical one-to-one situation. So you have to make sure that whatever education you need to provide, you are providing, whether in terms of the health aspects or in terms of wellness or in terms of care or in terms of medication, how you take the medication and all. So education is very, very important. And then of course, in telehealth is basically revolving around consultation and prescribing some medication, as well as some use of some devices for capturing some vitals and some even making some assessments. It depends on the complexity and advancement of telehealth service provider, how advanced they are, how much technology or devices they are using to capture things. Are you using, even going into telepathology or going to teleradiology? Even you are actually getting something, a scan done, and then you are looking at through a remote and then images and then giving the prescriptions. So it depends on the complexity and advancement of the provider, but mostly mostly is about medication. So after assessment of the patient, doctor makes a protocol, the care plan, and then accordingly prescribe medication or something if need be to be done. So medication prescription is very, very important and critical aspect. So we need to follow telemedicine practice guidelines within India, and most of the country have their own rules and regulations. So it's important that any telehealth provider must follow regulations applicable to the place they are existing or providing care. Okay, so I was just reading UAE, Dubai Health Authority standards for telehealth. So they have prescribed who and when can provide and what regulations are applicable to them. For example, if a doctor based in UAE and the patient is UAE, then he has to um, follow the regulation within UAE as well as a professional, as well as an entity. You know, so both the applicable as a professional, as an entity, as if it's an entity, as an organization, both are applicable. But in case a patient is now not in UAE, but the provider is in UAE, then uh, only the regulation related to professional would be applicable, not to the facility. So they have prescribed certain things. Same thing, TPG guidelines in India also prescribe certain things. Provider need to make sure that they follow those guidelines in terms of prescription of medication. So there is a list of prescriptions which can be provided during telehealth, and there is a list of prescriptions you cannot. So uh, those kind of drugs which are prohibited for prescription through telehealth must not be prescribed. Then hygiene and infection control is not basically about patient perspective of infection, because patient is not there in physical facility. Patient is at home or somewhere else remotely. However, patient can be in a place like there are kiosks, there are some centers where patient walk in, and then from that he receive or she receive the telehealth consultation. There are some providers who are actually created the hub and spoke model from one central place. They reach out, they have some devices or some, a facility of computer or video-based teleconsultation, and even some vital monitoring with the help of nursing or some assistant there. They capture some information and then diagnostics done and then transcript. So there are some kiosks by them or places. So in this case, then this infection and hygiene things comes in place. You have to make sure that the place is hygienic, clean, housekeeping good, and then infection protocols. Particularly like in pandemic, situations, how you really make sure you're distancing and all, and also for hospital-based telehealth service provider. It's not for patient safety, but for the staff or the doctor who is providing the consultation is very important. And also for a telehealth platform, for example, say Practo, which is not a hospital-based but you have a facility somewhere where are people working. So it's not for patients' perspective for hygiene infection, but for the staff or the person who are occupying that place. So you have to make sure there is no cross-contamination or infection moving from one person to another person. And then last but not the least is digital health application, DHA. And this is basically, again, with a dynamic vary from country to country based on the national protocols, national blueprints, national databases, and the regulations on telehealth or digital health applications, and also national protocols like ISO standards for making sure the safety of data information which you capture. You put somebody put user using American protocol, HIPAA protocols, but there are ISO standards also for information security and safety. But we have legislation, regulation around information safety, information technology as well. So and digital tools and techniques. So we can make use of all these based on the regulations specific to specific country. So this is about the broad perspective of the framework. Then importance of telehealth accreditation. Why a facility should choose for accreditation and what are the benefits? Actually, this is not just for facility. This is around the benefits for everyone, whether it's provider or receiver or a payer, whosoever it is. So it basically helps facility in demonstrating commitment to quality and safety. It assures community about the quality of services provided because it's based on third-party process, independent accreditation body. So it's not just you saying that you are good, but somebody else on for you saying that good, which builds the confidence of the community. Uh, Rights of patients are obviously protected because they are documented, they are communicated to the patients. It does demonstrate transparency in practices, demonstrate that facility functions in ethical manner as a practice. It's also an effective and efficient system for primary care. And globally, the telehealth is being used wonderfully and beautifully for primary care. So this is how, like now we have health and wellness center across the country, set up by government over 1.5, um, 150,000 centers existing similarly in private sector. So this can be a great tool for reaching out to the patient for their primary requirements, primary care. It ensures compliance to the prescribed telemedicine practice guidelines of law of the country, law of the land, a mechanism to ensure ease of storage and retrieval of patient information when needed, potential mechanism for safeguarding from potential legal liabilities because you have everything documented. So you follow protocol. So you have evidences for your practice and you can demonstrate that what you have been doing was being done in line with the requirements as has been documented. A process of accreditation stimulates continual improvement. It's not a one-time process, it's a continual improvement process. Keep you asking, keep you motivating on an improvement path. It also helps with the mechanism of self-regulation. In case there is no regulation, it helps you motivating in a self-regulatory environment. It's a need of the hour, and everybody knows about universal health coverage, which is our Sustainable Development Goal 3.8. I say this as a USC is a three-legged stool. The USC is about accessibility of healthcare to people without any financial burden, but healthcare should be of quality. So accessing to a quality healthcare without any financial hardship is universal healthcare. So telehealth is a perfect example if it is accredited. So if a telehealth service provider is accredited to provide accredited telehealth services, brings quality because otherwise you can also have quality component, but accreditation ensures that you definitely have quality component. And of course, telehealth is making healthcare accessible, as I mentioned, to provide primary care with many advanced things. As moving forward, also to remotest possible areas where there is no healthcare facility existing. So it's definitely making healthcare accessible to needy people and also affordable. So in comparison to a hospital care or a in-person visit to a healthcare facility, telehealth is affordable. So telehealth is a perfect example of universal health coverage progress of any specific country in this direction. Having said that, there are challenges and opportunities. It's very easy to say things. It's very easy to say than practicing things. It's very easy to say and read, and I'm reading many articles on digital health, telehealth regulations, and so on. And it says, okay, you are consulting, you just call on telephone, get a consultation done, or you can chat on WhatsApp and done. Everything's fine. But what about regulation? What about protocols around safety? What are the protocols around information security, confidentiality, consenting process? If you talk about India, there should be a consent process. There should be confidentiality procedures in place for the information which you collect from patient. So how about that? It's not that easy, Definitely, you call your doctor, you know, or available to you, and get consultation. That's fine, but it's easy. But are we practicing within the regulatory framework which is existing in terms of telemedicine practice guidelines for India, for example? Similarly, many other countries, they also have regulations, similar regulations. So it's not that easy. So we have to follow regulatory framework, whatever is existing. We make sure information is kept properly, kept confidential, kept secure. Nobody can access it. There is a consent process. There is a process to follow for prescribing medication. So it's not easy. It's easy in saying, but not practicing. Legal framework again. If something happened wrong, then what will happen to you? You will not be able to prove that you have been practicing as per TBC guidelines if you don't. You are not. So in a way, an advocacy tool for accreditation, because accreditation assures that the practices are in line with the legal or regulatory framework of the country. They are based on documented practices and protocols and procedures, and therefore can give assurance to patients, providers, and any other stakeholders of correct practices, the practices which are supposed to be done as per the legal framework. So there are challenges, of course, and there are opportunities as well. And therefore, for any telehealth provider, these things should be kept in mind and move forward. Now, coming to the next part of my talk is about the process of accreditation. In case anyone interested in it, as you've already undergone through the things, but in case there are people are listening from other organizations, there is a self-assessment process which makes the organization to understand about the standards, the requirements, and see where they are in terms of complying to the requirement of the standard. So self-assessment process, and then there is an application process. Once you identify gap in self-assessment, you start working on writing your protocols, your SOPs, your policies, and so on. Start putting them into practice, means implementation of those, and then practice because to generate evidence for an assessment team. If you won't practice to comply, we won't get any evidence. Then you won't be able to prove that you have been practicing as per the requirements of the standards. So then you apply in a prescribed application form along with self-assessment toolkit and required documents mentioned in set. Then the application fee, a review, we do the review, we register and then acknowledge. If there are any gap identified, we let the facility know about those gaps to fulfill. Then we review the self-assessment toolkit and give it documents. If everything goes well, then we conduct an assessment. So for telehealth, it's a remote assessment. We are not going on site unless it's a hospital-based practice. But it's a platform or virtual system, we go online, virtual remote, hybrid, in case it is required. But mostly it is a remote assessment. So after assessment report is generated and bring out the highlights of the findings. And if everything goes well, it's fine. If something is missing, then the facility has to take corrective actions, find out root cause and work on them. And then it goes to accreditation committee for review and accreditation recommendation. So if it is recommended, it is valid for 3 years. And within 3 years, we again check online desktop survey done for checking the compliance to the requirement of the standards. And then 6 months before expiry, the facility apply for renewal so that we get sufficient time to complete the process without giving a break in the accreditation cycle. So this is whole process of accreditation. Very clear, transparent, two-way traffic, two-way communication between us and the provider. So there's nothing to worry on. With this, I thank you, and as I mentioned in the beginning, that the question would be taken at the end. So I would be happy to take questions at the end of Dr. Paul's presentation as well. So thank you very much, Rajat, for giving this opportunity to hear me. Thank you.
Thanks a lot, Dr. Rana, for this beautiful presentation. We'll have the Q&As at the end after Dr. Abhijit's presentation. So, Dr. Abhijit Paul, the stage is all yours now.
Yeah, thank you, Rajat, for introducing Dr. Rana. Thank you, Dr. Rana, for once again meeting up on a common platform. Dr. Rana is one of my mentors. And when I started my career with the NABH, Sir was also the CEO there. And currently, of course, we are learning a lot through him in the QAI platform. And it's a real pride moment, for all of us to be, having him on this platform. Thank you, sir, for explaining the entire journey of the telehealth accreditation and going into a specifics and really detailing out the entire process and kind of easing out the whole lecture of mine. Actually, I don't need to explain anything about the accreditation process and how it really takes place. I would rather like to just share about 5 to 7 minutes of my time on the way Practo went in for accreditation, why accreditation, and what was our experience in the entire journey. So it was a kind of funny situation. I'll just share my slides. Is it visible, the slides?
Yes, sir, we can see.
Okay. So the thing is, most of the time, I being on the assessor side, it was also a very interesting moment for me to be on the other side of the table, be an assessee. And being an assessee for the first time, because this time on a different kind of assessment, because this was a telehealth assessment, and it was a really an exciting, exciting exercise. Why accreditation for Practo and what was our experience? So when we started the journey in 2021, so we understood, so we thought that we should, as a company, we should standardize our processes across different verticals. And as we know that, this is not clear. So as you all know that Practo has been having a long journey of almost 15 years into the business. So if you see, everybody knows Practo as a telehealth platform and which connects a doctor to a patient through an app. So that is all we know about Practo's activity. For many of you who already know our journey, and some of you who do not know, I would like to just take you through the milestones on the journey of Practo, which is a company which started in 2008. It was a company started by three engineers who were in their final year of engineering college, very young, in their late teens. And they started this company in 2008 as a company which was dealing with software as a service. So, and the first product that we gave was called Practo Ray, which is still there, which is a software program used in healthcare. It also helps us to maintain patients' digital records. Of course, there's been a lot of version changes and it has been modified over the period of years. In 2011, we were having more than 11,000 clinics which were using this software. 2012, we launched what is called as Practo Pro, which was a mobile app used by the doctors. 2013 saw Practo launch its Practo.com website, which launched the first real-time appointment for the first time in India. So anybody could log into the Practo.com and book a real-time appointment. This happened in 2013. 2014, we started profiling the doctors on our websites. So if you click on a doctor, you will get all the profiling of where, what degrees, which medical college, what specialized training, what are the fellowships, where is he practicing. And Dr. Rajat, who is anchoring this program and who's the moderator, he is actually involved in, and he is the person who does this profiling and helps us credential these doctors. He goes deep into the, doctors' credentialing, and he's the person who helps us with this profiling. So it's a large number of doctors on this platform, and it's a huge amount of work. He's got a large team with him to do that. 2015, Practo acquired two companies, which is the Insta and the Quickwell. So Insta is one of the very, very famous and very good hospital software, which is used across the Middle East. if you go to the GCC countries, recently there was a summit which incorporated the 12 nations of GCC. So across GCC, from Saudi Arabia, Qatar, Dubai, everywhere, there's a huge demand for Insta as a hospital software, which is a very successfully running program in the Middle East. 2016, we saw almost 10,000 clinics and hospitals using both Insta as well as the Practo Ray software. And we started launching the patient stories on this platform. 2017, we launched our medicine delivery system and our diagnostic vertical. And 2018, we were almost having 8 crores users across India and overseas using the Practo platform. And we also launched what is called an affordable health plan and wellness plans. So this was done with tie-ups with many corporates. 2019 was a time when pandemic struck, and there was a huge amount of demand on the telehealth. There was a huge burden on the telehealth, and crores of people were seeking telehealth as a platform to kind of reach out to their doctors. So both for doctors and patient, it provided a boon. And Practo managed to decrease the waiting time for the appointments if a patient books appointment through the Practo platform. So we guaranteed a turnaround time or a waiting time for a patient's consult in 2019, and it was in a very, very mass scale. It went into lakhs and crores of appointment. Then when we were doing this exercise, we discovered that of the telemedicine patients, there was a huge requirement for patients those also required surgery. And if you remember, during patients' COVID time, it was very difficult for either a doctor or a patient to really come and face-to-face with each other and kind of even take a surgical consult. For example, if you have a pain in gallbladder, okay, you can't actually go and meet because it's hospitals are packed and full with COVID patients, ICUs are full, emergencies are full, but at least you need some kind of a relief. So we felt that there was a space for even surgical care, at least in secondary surgical space, at least for a first triage kind of a consultation. Of course, in every surgical consultation, you require a physicality, you require a physical examination of the patient, but we felt that we could extend this virtual meet into also a preliminary triage kind of relief to the secondary care surgery. So we launched our Practo Care Surgery in the year 2021. In fact, my vertical, I started my journey with this vertical, and my team actually we started making the SOPs and understand how a physicality could be hybridized and clubbed along with a remote assessment. So we formed and we really burned the midnight oil, and we used different kinds of tools, algorithms, the product team helped us to really get the software into place so that we could do this, and we could kind of triage patients to certain Practo driven clinics inside out of 23 cities across India, where if a patient needs a consultation, the doctors and patient could meet up physically after initial triage over the virtual platform. And if required, we had partnering hospitals which were screened by us, who could take up patients and who could do the surgery, of course, following a certain protocols. So this was one thing which was largely successful, and it fanned out of 23 cities across India in different geographies. 2023, so we saw that this was a large-scale operation, both in virtual as well as on a physical platform. So we felt that we should go for a standardized accreditation process. So I got in touch with Dr. Rana and the QAI, and we started this exercise in 2022. In 2023, January was the accreditation. We had a assessment, and of course in the month of April we got our certification. I'll come to that. And this encouraged us to also get into more physical space. We also saw there was a huge demand for dental ailments across India, because even in COVID time, because people were scared of ENT and dental ailment, because most of the dentists will not see patients physically. ENT was another problem because these are all dealing with airways where a virus can get transmitted. So we started our physical dental chains in 2023. And to give you all the good news, this month, in the first week of this month, Practo started its first hospital in Bangalore. So we started our first secondary care hospital in physical form, which is located out of Electronic City, the first Practo hospital. And we are planning to have 20 hospitals in the next 2 years across the different geographies of India. In a nutshell, what we did is we started off our services as software as a service, teleconsult service. We moved into primary care, then into secondary care, dental chain, and then finally into hospitals. So as we developed our presence in different geographical locations in India, and as you all know, India is a vast geography with its own diverse ethnocentricities, its diverse practice pattern, cultural issues, even our medical training are so different. So in fact, the NMC is trying to, and it just rolled out a notice that they will have a common forum where we can all register ourselves with the NMC. Even if you change from one state to the other state, we have to change our registration. So we felt that we should standardize the entire protocol and practice of both telemedicine and physical medicine. And whenever we talk of standardization, it translates into patient safety, and patient safety eventually translates into clinical outcome and also patient satisfaction and trust, which Dr. Rajat was just mentioning in the beginning of the session. So we felt that we should be accredited as a body so that people have trust on us and we provide uniform standardized care across the geographies of India, wherever we are present. So if you see in the market, there are so many telehealth platforms. I don't want to mention their names, but there are, apart from Practo, there are many other platforms where both surgeons and patients are brought into in a common platform through apps. So we felt that this market was largely unregulated. So we felt that we should have some kind of a self-regulating organization, and we should all meet up and have some kind of a ethical standard or some guidelines which should drive the practice of telemedicine across the board in India. So with the help of the Internet and Mobile Association of India, we formed a charter and we kind of got together and we formed a draft of the code of conduct and ethics of how to regulate this space, which was largely unregulated, how to get certain, what are the do's and don'ts we should be doing as a telehealth provider. And I was also a part of this document formation. And this document was eventually presented to the Niti Aayog, and it was accepted by the Niti Aayog. So this was one landmark. For example, I'll just give you one simple thing. Like most of the telehealth platform will write best doctor, best surgeon, fastest time. So best doctor, best surgeon, fastest time, these kind of words we felt that we should not be using, because what is the best is again a problem, is again in question. What is the fastest time is again a question. So things like that. So there were also certain ethical rules that was carved out into these standards, which is mandatory and a sine qua non for all the digital players to kind of abide by. So when they play on this platform. So we brought in an SRO. So and this was rolled out last year. Following rolling of this SRO, we felt that it would be a good thing to to have a gold standard of care delivery and to kind of have it on a telehealth space in India. So that is why we felt that we should go for. So we were hunting around for which accreditation body should we go with. We kind of Googled around. We saw some of the bodies in the Western this thing. We saw even one of the Indian bodies which we felt that we should go with. But then at the same time, we were not finding accreditation body which could kind of help us with getting accredited and give us this visibility. So that point in time, we touched base with the QAI, and we found out that the QAI has got a completely a separate vertical for accrediting telehealth, which Dr. Rana had very nicely showed us, and he explained the entire thing to us. So in the meantime, what we were doing in our own space was that we were also having our own kind of a protocol of credentialing the doctors who are on telehealth platform, going through their, there was a team which would go through their entire degrees and their registration process, their professional indemnity, their training, and there would be a separate team which would be training the doctor on the way of how to conduct a telemedicine consult. It's not that once you are credentialed and once you are onboarded, you straight away start the next day. So there is a training program, there is a team behind it, which takes a full training for the doctors. And once the doctor satisfies them that they are capable to understand and do the teleconsult in a protocolized fashion or in the way that we have kind of charted out, then we allow the doctor to start his consultation. And following that, the doctor is closely monitored. Both the patients and doctors are monitored from the back end, and all the video consults, the turnaround time, the prescription compliance, everything is audited, and there is a team which reviews these prescriptions and also gives a feedback to the doctor and also tells him about the deficiencies that are there, so that he can or she can improve upon the quality of the teleconsult. And there is also, we see that the patient goes home more happy, and there is a CSAT score which is more than 95% now, which is going in the teleconsult. It was way down in the 80s, but we have managed to pull it over 95% using this circle of satisfaction. So whenever we talk of any service, we always see, into tangibility. Nowadays, if you talk of any service, we first see the Google rating. Okay, what is the Google rating of the doctor? So if you see 3 out of 5, you will not go. If you see 4.5 and above, you will try to go. So we felt that there has to be a tangibility in every activity or whatever we are doing. Google rating is one of them, but then it is again vague. It is very subjective. It is completely given by the patient. So Practo, we devised something which is called Practo Excellence Score. And this is completely based upon guidelines. It is based upon the best clinical practices. So what we did is we developed the clinical excellence rating on the dental clinics. We went deep into the American Dental Associations, and we saw their practice pattern. We got their documents, and we saw how do they score each of the dental practices. And with that, we factored into the infrastructure, the process, and the outcome of every clinic. And we developed a nice Google scorecard. And we ourselves go into each of these dental clinics. There is a biweekly audit done by our assistant medical superintendents, and they go through each and every procedure. We take up one ailment. We see the patient walk through from the front door till they leave the clinic. The entire tracer is done for every ailment. For example, there is a root canal treatment, there is a scaling, there is a prosthodontics required. Entire thing, we kind of trace the patient, and there is a dental clinical excellence rating score which is given. Likewise, on the teleconsultation platform, Practo has developed a unique OPD consultation rating score. We also have a clinical pathway score. For example, if you are doing a hemorrhoidectomy, or if you are doing a HAL-RAR procedure, if you are doing a laser hemorrhoid, if you are doing a laparoscopic cholecystectomy, so there is a clinical pathway device for each of them. And we see how a surgical care is taken in right from the doorstep of the hospital, starting from the medication reconciliation, starting from the antimicrobial stewardship, starting from the WHO surgical safety checklist, starting from the pain management, wound care, and following the modified Aldrich scoring system for discharge of patient from the recovery into the wards. So also we see any kind of re-exploration. We see the usage of blood and blood products. We see the post-operative infection. So it's quite an elaborate scoring system which sees the clinical outcome also. The surgical outcome score we have developed across all the PractoCare surgery platform. And what we have started doing now, just to inform Dr. Rana sir, we have started the first hospital in the Electronic City, and me with my team, we are slowly fanning out the standard of the QAI in our Practo own hospital. POH is Practo own hospitals. So we have hospitals ranging from 50 to 100 beds. So whichever hospitals are less than 50 beds, we are using the SHCO, which is the Small Healthcare Organization Standard. And those which are larger than that will be fanning out the full standard of the QAI. So all our hospitals, we are planning to have the QAI standards going forward. Why QAI? As you see, it's a gold seal. But more than the gold seal, it is the first and only body which was certified by the ISQA for the digital health accreditation in India. And why QAI again? Because it has got all updated and recent standards and guidelines applicable to the telehealth. It's one of the most recent accreditation body which adopts all the recent guidelines. It is clinically very aligned to the patient care. That is what we saw as an auditee, and on being on the other side of the table. It is easy to implement. The standards are very easy to implement because many times, you have standards where you can't implement them. So you have to do something, you have to take help, you are really confused. So standards are very clearly defined and implementable. They are very, very practical for the on-ground staff and the supporting staff. Sometimes a nurse or a on-ground RMO or a housekeeping personnel or a technician, he should be able to implement that standard, and it should be practical. It should be, it should be related to patient's care and hands-on. And it also demonstrates transparency in practice. More than all, it also ensured ethical clinical practices without any gray areas and ambiguities. Believe me, I have been on both sides as an assessor and an assessee. I have also been a part of the accreditation coordinator in some of the international accreditation. Sometimes there are gray areas in those standards and in the measurable elements or the objective elements or the criterias, whichever terminology we use. And sometimes we really don't know whether this is correct or that is correct. There will be different assessors coming and giving you a subjective explanation for each of them. You believe me, the QAI doesn't have those gray areas. Yes, it's very well-defined standards, very well-defined criteria, and there is no ambiguity. So this is something which was very, very important for any assessee or any hospital to have very clean-cut explanation of how to do, what to do, when to do, and how to fulfill these criteria. So we found that with the QAI. So coming to the accreditation journey, as Dr. Rana had beautifully shown in the second last slide of how we prepare ourselves for the journey, we also followed that same pathway. But then at the same time, being the first accreditation, we were the first telehealth provider in India, which was trying to apply and get this accreditation. So we were a little bit nervous also. We would be going for it, and if it doesn't happen, what to do? So we kind of approached Dr. Rana and his team, and the QA was very, very kind to handhold us, and we opted to go for a program of implementation to how to implement these standards in Practo. Though we were having our own SOPs, we still wanted to learn from Dr. Rana and team how to implement it. So the entire POI was taken by Rana sir himself. So he himself educated us over very long sessions of POI. We had almost 40 to 50 stakeholders on ground who would be real-time involved in this accreditation. And each and every standard and the criteria was explained, was kind of all the doubts were cleared in the POI. So I would rather say that anybody or any telehealth which likes to go for a POI accreditation should definitely go through a POI program. This will really help you to, first of all, understand the standards better, to clear all your doubts, and will help you to create your SOPs without having any glitch or without having any confusion. After that, we went through a self-assessment toolkit, what was already there in the armamentarium, and then we made our documents and SOPs. And then we started seeing whether we are compliant to the SOPs, the training, the practices on ground. And we did a dry run following that, and then the application, and then the D-Day of assessment was done on the 16th of January. When all of us were there, it was a virtual assessment. When I asked Dr. Anaki, sir, will you come down to, will you send somebody to Bangalore? Then he told, come on, it is a telehealth assessment. So obviously it will be a telehealth assessment. So it will be a tele, it will not be physical. So it will be virtual. So we went virtual, and we were very, very happy to have one of the very, very senior and very knowledgeable principal assessor for the accreditation, for the assessment. And there was enormous amount of learning from him, from the principal assessor to the entire team of Practo. There was emergence of newer concepts and refining of our knowledge, and also it helped us to improve our scopes and our the way we were delivering the entire telehealth healthcare. Of course, there were some observations which were given to us, and we reached out to the QAI sometimes to help us understand, how to close them. If you see and if you ask me as an assessee, and see, I have been on both sides, as I told you, and I've also been the group head for quality for a very large healthcare, one of the largest healthcare in this country. One of the problems that we face when we kind of go with any of the assessment bodies, is a difficulty in communication. Sometimes they will not pick up your call, they will not answer your telephones, they will not answer your emails, they will not, give you clear-cut directives. Believe me, the USP of QAI, they were extremely courteous, extremely approachable team with a very positive and ready to help attitude. And you will not believe, from the QI Central Secretariat, every time we reached out to them for some clarification, it was resolved on the same quarter of the same day. It never went to the next day, or even never went to the next half of the day. Sometimes it was done almost within hours. And we found excellent response time from the QI Secretariat. And all directives were very clear, effective communication, and each were backed up by evidence-based guidelines and clinically driven, clinical medicine-driven evidence-based guidelines. So it was not in ambiguity, it was very clear for us to understand and to implement these standards. So these are the few pictures of 16th January when all of us, faced the audit in real time on a virtual platform. This is me on the top, Dr. Sudeep, our whole quality team. And on the down bottom, you see the governance and leadership session, which Dr. Rana mentioned. And it was a whole day exercise. We also had to carry the video camera with our facility manager, Manjunath, who carried it across the entire facility to show in real time on different compliances of the facility, whether it is a firefighting hydrant, whether these are sprinklers, there are smoke detectors, there are fire doors, the drills, and everything was virtually assessed to the last, last detail to the. So that was a very, very exciting kind of learning and a very exciting time kind of assessment protocol. And then finally on the 2nd of April, we got the information and we got our certification. And Practo became India's first telehealth platform to receive the gold standard from the QA accreditation body, which is valid for 3 years. And we are so proud to be a part of the QAI in this journey. We are proud to be the first telehealth platform in India and the second in Asia, following another organization in the UAE, which is the first in Asia to get this gold seal and this prestigious accreditation of telehealth. And we promise that we will be maintaining this standard and we'll be finding ways to improve our qualities and get in more innovations. In fact, now the responsibility comes on us to really improve this standard and to set the benchmark for the rest of the country and to lead the whole country in the space of telehealth. Thank you, everyone, for your patience hearing, and any queries I'm willing to answer. And over to Dr. Rajat to carry on the session. With this, I stop and I end my presentation. Thank you.
Thanks a lot, Dr. Abhijit. So what I'll do is I have a set of questions which have come from our viewers, and I'll be reading out to them. Reading out these questions, and probably I'll start with Dr. Rana. But in between, Dr. Abhijit, if you have something to add, please feel free to answer the questions. I have some overlapping questions. I have some overlapping questions based on both of your presentations. Don't worry. Okay. So, Dr. Rana, the first question, you know how Indians are price sensitive. The first question is, what are the financial implications of quality accreditation? Quality accreditation for healthcare providers.
So very complex question to understand. So the cost implications are for many, for the provider, how much he charges, whether he gets the what he is supposed to get, and the
So
patient
ballpark
to pay.
estimate would do.
So and the patient to pay, right, or
Uh,
the insurance to pay. So what this question relate to which component actually?
Sir, as I understand, since this is a accreditation process related topic, probably the viewer means whoever has written this question means how much will it cost for to undergo a
An
accreditation, let's say
accreditation.
for a clinic or a
So
setup.
very good, good. Thank you for clarifying this. So cost of accreditation is based on how much you prepare for, you know. So as a matter of fact, from our side, the fees is based on the number to actually rationalize. We have rationalized the fee so that the smaller pay the less fee and the bigger pays the bigger fee. You know? So we have categories based on number of consultations per day, like up to 100, up to 500, up to 1000. So there are 3-4 categories of fee structure which comprise of application fees and annual accreditation fees. I can pull up by the time I look at the second question, but the fee which is there, it is not something which can be a hindrance for any telehealth provider for getting accreditation.
Sir, what I mean, I'm interrupting. What I understand is there's no fixed fee structure. So there may be ranges.
There is a fixed fee structure for.
Okay.
I'll just pull it up. You know, there is a fee structure for organizations because just a moment. Give me a second.
Sure, sure.
I'll just pull up.
So, should I go to the second
Yeah,
question while you are pulling up the
Yes,
data?
yes,
This question is directed to both of you, but I'll begin with Dr. Abhijit. So, the question is, sir, the first part of the war is over when you get the accreditation. Okay. Now, what are the best practices one must follow in order to maintain or improve the standards? So, after 3 years, if I'm not mistaken, is when the second quality inspection takes place.
Yes. So most of the hospitals that we have worked in, we see that they get geared up about 3-4 months before the accreditation, and once it is over, then they go back to square one. So, but then, I mean, this is a reality in hospitals. But then we have a team with us who are all from the top corporate quality hospitals. So I'm very lucky to have a very large team, fairly good team with me who was the experience of being in the best centers in the country. And we know this fact that that people become slacked. So what we do, we have a biweekly kind of a review in the dental space. We have a regular review, as you know, Rajat, in our teleconsult space, and we also have almost a daily review in our secondary care space. We just started the hospital, and we are just trying to fan out the scope of services, the SOPs in the hospitals as per the QAI standards. So getting the initial accreditation, as you told, is always easy. But then, yes, one good thing which the QAI has done is to have a surveillance in between. If you see after 18 months, that means almost once a year, there will be always a face-to-face contact. So that will, and Dr. Rana told that 6 months prior to that, you have to get geared up. So almost every year we'll be assessed, and 6 months prior to that, we have to gear up. So you only have a breathing space of effectively 6 months. So we have to see whether we can pull up people during these 6 months and not let them breathe much. So let them run. So the
Sir,
thing is, we have, yeah.
based on your experience, which are the key areas you would want your team to look for? I mean, in this period of 6 months.
Yes, number one is, of course, the medication management is a big exercise which always goes down, as you also understand. Medication management. Then another thing which goes down generally is your compliance to documentation sometimes, but not in core areas like operation theater, critical care, because there we collect a lot of data. But generally in the wards, in the OPDs, where the people lower down their guards. Yes, to do it, and also we see generally in a setup to do with infection control. Things to do with nutritional assessment is another area where people try to become little slacked. Some of the drills, people become slacked. Maybe fire, maybe code blue, Some of them, people try to become slacked. This, I'm just giving you a first-hand experience of mine. So yeah. And of course, the biggest challenge is if you have change in personals, like if you have the employees changing, and if you have fanned out in newer geographies. What I see Practo's main challenge would be, because we are growing into tier 2 cities, we are growing into other locations of India, in Lucknow, Kanpur, in Chandigarh, in Bhubaneswar, Calcutta, many other geographic, Vijayawada, and all those places. The more we expand our geographies, the more we have more people on board. It would be more challenge to train people, and the compliance would get a little diluted, but we have to keep on keeping our guards up and training people more and more. So it's a lot of training. Training is of course a very easy word to say, but yeah, to ensure that we get the right kind of people on board. So I made it sure that whoever comes on board, they have some experience of quality from their previous background, and they understand what is accreditation, what is quality, and have something in them. One of the interview criteria is that. So at least they understand, that basic things in quality, and then we can take them to the journey further. Yeah, it's a challenge. The growth is a challenge. The change of leadership, the change of manpower is a challenge, and these are the few areas which are of course challenge to maintain. Yeah.
Thanks, Dr. Vijit. We got the answer from one section, one side of the table. So I'm going to pose the same question to Dr. Rana. Dr. Rana, which are the key areas from the viewpoint of QIA you would be stressing upon the second
Rajat,
time?
Rajat, if we restrict discussion to the telehealth uh,
Huh,
accreditation,
huh,
so compared to a hospital is very limited. And
okay.
of course, the focus remain on all the 10 chapters. It's not that any chapter can be excluded. So all 10 chapters are equally important because they are connected to each other. But of course, certain things which are critical, like say medic, like Abhijit also mentioned, is about medication. Because in telehealth, medication is one of only thing which is being prescribed, by most of the providers. Some, of course, may be doing advanced medical device uses, but medication is one. So whether the provider is really providing prescribed medication out of the uh, what do you call it, allowed list of medications, not something which you are not allowed and you are prescribing. So that's one thing. Then the consent process. Consenting is also very important, because these are the things which actually creates problem later on if something is not good. So whether you agree with or you have told all this. So consenting is second. The third thing basically is your system for storing and collecting and storing the information. Whatever you are collecting from the patient details or any imaging details or any data or any image for scanning and everything. Whatever you are collecting from patient, how you are collecting and then how you are keeping them to ensure they are safe, they are secure. Nobody can get access to without any authorization. So, and then of course, demonstration of continuous improvement. How
Right.
you how you really measure your performance indicators and demonstrate that you are improving on ongoing basis. So I think these are some of the key areas which actually provide a lot of insights into the systems, and then you can catch up on. If something is missing here in four area which I mentioned, then you can catch hold of the governance and leadership. Then what are you doing? You can also catch hold of the human resource management, what you are doing, so all these four things can to link to all the rest of the six chapters as well. So
Sir, if you could shed light on the cost. Uh,
yeah, it's up on my screen, so I just share the screen itself. So this is what is the fee structure. Is on website available, right? So it's not something hidden secret. It's an open one. So it's based on the number of consultation per day. So there are three categories. So less than 100 consultation a day, then 101 to 1000 consultation a day, and more than 1,000 consultation a day. So these are three categories, and based on three categories, there is an application. So if you look at less than 100, it's not 10,000 application fees and 25,000 is the annual accreditation fees. For second category, 20,000 is annual application fees and 50,000 is the annual accreditation fees. And for the larger one is 30,000 application and 75,000 the annual application. So this is the only cost they need to incur. And as there is no travel from the assessment team, it's all based on virtual, so there is no other cost also. So this is what it is to be paid. This is for the Indian providers. We have another structure for same structure for SAARC countries. So all 11 countries within the SAARC region, they enjoy the same fee structure as in India. But if a country, if there is a country outside the SAARC region, then there is another fee structure for them.
Right. Sir, I mean, even though I have not been asked this question, but then it would be a logical linker to the previous question. If somebody happens to fail the, accreditation test, accreditation, so I'm given to understand the application fee is non-refundable, but
Yeah.
the annual fee would be waived off, right? Since he's not accredited, right?
Yeah, see, yeah, logically, but as a practice, to be honest, as a practice,
Huh.
all accreditation bodies globally, they charge the annual accreditation fees before they give the certificate.
Oh, right.
Okay, but one thing is here to be given attention to, Rajat, that the process is such a way defined that until unless a healthcare provider is not done anything, can only fail. You know, see, when that is why particularly we as kept as a barrier as a self-assessment tool. So when you fill the self-assessment tool, now you take the risks. See, there is a scoring pattern of 0, 5, and 10. 0 means you don't have you less than 30% compliance, and 5 means 31 to 69% compliance, and over 70% compliance is 10. Now, when you score yourself, when you don't really do it properly, ethically, and legitimately, and you give everything 10, 10, 10, so you feel happy, but though you know that may not be 10 or 5 even, right? So when it goes to the assessment, there are all 5 or 0, 5 or 0, so you will fail. Now you have taken that risk. So if you have done your self-assessment properly, you know why you go for assessment until as you are convinced and confident that you will pass. So if you follow that route, you will not fail. That's number one. Number two, even in when you attempt it very well, still you can get 5 and 0s. Still you can get 5 and 0, but still that does not hold you not to get accredited. So we'll give again a 90 days of period that see these are the deficiencies. You really work on it, fix those, generate evidence, give the root cause analysis and evidence, and come back to us. We review it, and if we find okay, everything is done, we say okay, you are accredited. So the process is such that until unless you yourself want to be failed, then you will not fail.
I think, sir, you answered the third question even without knowing it. The third question was, if I fail, is there a cooling period before I can, reapply for the application process?
So you
So,
won't fail actually
it's
if
a
you
you
follow. Yeah.
uh, you are giving a 90-day period for him to do a kappa, right? If
Yes,
I'm
yes,
not mistaken.
yes, yes. You do that and then submit and we review, and then we take it to the next. So until unless we get everything, we will not proceed further actually. We will not take it to the accreditation committee unless we get all the corrective actions and score is minimum, and then whatever is gaps are identified, they are taken care of. Number one. Yes, if there may be case when a facility is already accredited now. Now that facility do not follow the terms and conditions to maintain the accreditation. That means they misuse our mark claim, or they during the surveillance they found to be completely lack, and not maintaining. So based on the outcome, there may be possibility that accreditation may be suspended or withdrawn, or even there is a complaint, or there is a report in the media which is verified and found to be correct, which lead to some serious issues. Then accreditation can be suspended or withdrawn. When the accreditation is suspended and withdrawn, then there are time gaps that if you are suspended, you have to be practicing and fixing things at 30 days or 60 days. If you are withdrawn, then you have to. So based on the conditions on which it was withdrawn, there are time gaps so that you can't apply within these days or so days. So
Right.
that is the only thing which takes care of. Yeah.
Thanks a lot. Dr. Abhijit, the next question goes to you. I'm sounding like a quiz master.
No issues.
So I don't even know, Dr. Abhijit, whether this question is even relevant for today's discussion because I'm a bit confused. So this is from Dr. P.K. Satpathy. He wants to know what is the cost of training in telemedicine. Is it mandatory? Till now, I don't have any response. How to get the response? Is there any marketing strategy? So that's
No,
why I'm confused.
I'll tell you. Uh, I think if you are inclined towards getting yourself accredited in telemedicine, as I told, it is very important to understand the standards for which I feel if your organization is going for telemedicine, you should go with a program of implementation, POI. That is the training which the QAI gives, which we also took from Dr. Rana and team to understand the standards and the criterias and how to go about fulfilling those criterias. Sir, do you have anything to suggest, sir?
No, I think you're right, Abhijit. Any organization is interested, they should start with making a team within and then get them trained with us. We will train on the standard and implementation, so the journey become easier. And maybe before I hand over back to you, Abhijit, is that if you are asking about the training on the practicing telemedicine, if you go through the telemedicine practice guideline, and then later on the government also says that everybody who's practicing telemedicine as a doctor then should undergo a training, in next 5 years. They have given a time of 5 years. And then I don't know what is happening with that monitoring, but it was to make sure that the doctor who is going to practice, they know the rules. If you don't, that's why I mentioned risk and opportunities, challenges and opportunities. Is if you don't know, you are just call a doctor and doctor say take this and then something happened, the patient goes to somewhere. I say then he will be in problem because he has not followed the practice guidelines. No consenting, no protocol to follow to keep the record, follow up, and all these things. So I think there are two types of training you need to take as a training for practicing telemedicine as a doctor. Second thing, you need to be trained to practice telehealth standards for accreditation.
So I didn't go into the second part. The second part where a doctor needs to be trained on the standards of telemedicine, we do it in Practo. So any doctor who kind of gets credentialed, as I showed in my slide, we give them an extensive training on all the nuances of how to conduct telemedicine, and then only we allow them to start their consultation. Rajat.
Yes. So one last question to both of you. I'll direct the question first to Dr. Rana, followed by Dr. Avijit. I think whoever wrote this question, I don't have the name, is probably overwhelmed with ChatGPT. So the question specifically says, I mean, that is playing in the mind subconsciously. Are there any specific resources or tools available online to assist with quality improvement and accreditation resources to make
Okay.
life easy? I mean, that's
Yeah,
what I
yeah.
understood. That's why I
I
brought
think the
the ChatGPT.
point is quite valid and relevant to think about it. Currently, with us, no. We only have a self-assessment based on the standard, which anybody can use an electronic copy and use it. Thing. Of course, there are many other programs available globally. If you Google it, you will find there are several trainings and programs on telemedicine practice and all these things are going on and available. Nowadays, there is no dearth of information available universally. But as far as if you are linking this question with accreditation perspective, then we only have the standard based self-assessment. No, nothing based as a Google based or web based system, online system available at the moment.
Right. So, I mean, another thing strikes me back during my 10th and 12th standards, we used to have those, 10-year best question papers, and there would be one or two ideal, model questions, model answers. Is there something on your website which will help, upcoming doctors who are planning to go for accreditation for their clinics or whatever?
See, for accreditation, the only thing is relevant is the standards, right? So standards remain standard. You can't have the okay for a newcomer. These are the 10 things you do. For the advanced, you 20 things. You 10 chapters you do. You do 3 chapters. You do 5 chapters. You have to do all 10 chapters, right? The only thing will be the beginner may score 70% because we say to qualify for accreditation, you score in each standard. You score minimum 5 and then each chapter you score 7 and the entire standards for 10 chapters you score more than 7. So this is the minimum scoring criteria. In addition to this, you have to fill the gap if there are any gaps identified, but after filling those gaps you qualify for accreditation. But if you don't get scoring to this level and if there is no gap, it is not possible. You have to have some gaps if you have no scoring. So you have to really wait till you complete that scoring to minimum level and fill those gaps. So I think, but definitely in other ways that certain guidance documents, certain sample documents, for different requirements of different chapters can definitely be developed. And we are working for some other standards, and hopefully we will come out with something on this also as we move forward. From the experience we came, like we have Practo already. They have a lot of experience, so we can work, okay, can we do something like this? So I think as we move forward, we can have some guidance documents or protocols, as you mentioned, sample papers, you know, on different topics
Right.
like medication safety or consenting things and all sort of things.
Right. Dr. Abhijit, to extend the same question, I would want you to have a take-home message for our viewers. I mean, what would you say about the same question? Are there any resources or any tools which you feel would help them for this accreditation readiness?
Yeah, depends on which geography you are.
Okay.
Though we know that health is a state subject, but then there are national guidelines which drives most of these, the way we practice. So there are telehealth guidelines which are available. I don't think if you are in India, you have to follow the rule of the land. If you are in some other countries, you can always see what suits your regulatories there. So it is best to follow the rule of the land and to also follow the guidelines which are specific to our country and to our state, because also there is a slight variation on state subjects also. So according to that, we can imbibe those practices and be safe. At the end of the day, patient should be safe, and also the doctor should be safe. Should not
Right.
face any litigations and should not face any issues in delivering, because no doctor would have a bad intent or intent to harm. Do no harm. That is the first thing, whether it is a teleconsult or a physical consult, and be very clean and transparent in your dealing, and also be always guideline driven. Always study the recent updates of medications that you prescribe, and any newer advances, anything that has come up. You have to keep on reading and updating yourself, and just follow the rule of the land. That's it. So that is my last advice to every doctor
I
who
think
comes on this.
just I add what Dr. Abhijit mentioned. In my imagination, I would say imagination and my thinking as I see people providing consultation, including a couple of my friends, for me also, myself also. The one of the most thing which is written in the TPG guidelines, which is not practiced, is identification of a doctor and a patient. See, Practo has a platform. So when the patient comes, he knows which doctor he is going to consult. And when doctor sees, he knows which patient he is coming to. And there is a video they know and the identification is already established. Now, when I am getting a consultation from Dr. Say Abhijit, and he is my friend. So he said, okay, we know each other very well. But if something goes wrong, I say, where is the evidence that you identify me as a patient in your system, you have not checked my Aadhaar or passport or any ID card to ensure that I am your patient. And also for medication prescription, which is a sometimes age specific and weight specific. So if you don't ensure my age and you prescribe medication which is for a pediatric, which is for an adult, but I am not adult, I'm in a pediatric group or something like that. So I think that these are the things which are very important for that's why it says in one slide, telemedicine that's a challenges and opportunities is
Right.
easier saying than practice. easier कि फोन करके कर दो बट कर तो दिया लेकिन है कौन वो दोनों है कौन हमें पता ही नहीं है.
I would like to come here. See, there is a way to do it. In fact, I will work with my team and see if it is possible to do that in our platform. There is something called as proctored tests. Like if when we write our exams, like I had also appeared for some of the exams for the Indian Institute of Management, what they do is we can take the exam from any geography. It is on the, so before the start of the exam, we have to kind of, show our ID card like this. हाँ, तो ऐसा करके आईडी कार्ड दिखाना पड़ता. So the ID picture of the ID card comes,
Yes, yes.
it is captured, your face should be captured, and then once that is captured, you share your whole screen. You have to give the permission, and then the exam starts. So it is a proctored exams where you are monitored. I think the same thing, Rajat, what sir just told now, it just brought in this idea through this conference, is that we have to request the product team to show, the patient should show some ID which contains their age, at least, and their age and sex, so that at least we know that it's the same patient who is going for a teleconsult. It is a very, very good idea, sir. You just brought it in I
So,
think
I'm,
it's
Dr. Abhijit, I'm not sure. Perhaps there may be a mechanism of linking the Aadhaar. So that would be an easier method rather than asking the patient to show, because some will forget to carry.
yes, yes.
Yes.
Yeah,
It will work.
somewhere, but again, we have to be mindful that Aadhaar is not mandatory, and a patient can say, I don't want to share my Aadhaar
Ah.
because this now is a thing that Aadhaar is linked to everything. So
Hmm.
if you get Aadhaar number, you know everything about that person. So, but see, it's not difficult for a platform.
Hmm.
Not when patient comes, he will show his identity. You ask for some identity card, and then if it's a video consultation, then you should know the person you are seeing. So it's just to establish the identity of the patient that yes, this is the same person you are providing the consultation to.
Right.
ABDM kind of thing. Yeah.
Yeah,
So
yeah, yeah.
one last question, it came to my mind because both of you were talking about this being friends consulting each other. So there is a equivalent law in America called the Good Samaritan law. So I'm giving an example. Let's say I, as a doctor, is traveling on the road. Suddenly there's a road traffic accident, and I helped one of the patients, one of the survivors there, and he takes me out for lunch. Even though it is like, I mean, I don't consider it as a fee, but something goes wrong, I am legally liable just because I took that lunch. I mean, is there something similar happening in India? I know there is no good Samaritan law, but you said now we should be uh,
See, in
taking
India,
our all.
we have a Consumer Protection Act.
Huh.
How the consumer is defined. If you are taking fee in any manner, you become a consumer. You establish a relation between consumer and provider. If it is
Even if we
totally
are
free,
friends,
if it is
even if we are friends,
does
sir.
not mean any relation. It does not
Uh,
define the relation. It
okay.
defines the relation of consumer and provider in terms of the money. If you are
Okay.
says if any hospital is providing all care free, then there is no relation between consumer and then that person is not legally held responsible. But if you take anything, either cash kind or any something which can be proven as that this was equivalent to the money, I took it for lunch. So something
No, but
like that.
I didn't ask for lunch. He forced me to lunch. That's the
So then he has to prove that he forced me to prove this is not a relationship between that.
okay. Okay. Thanks a lot to both of you for taking out your precious time on a weekend. And to my viewers also, I want to reiterate that if you like this video, please like, share, and subscribe to our videos, and we'll come back with more interesting videos and more sessions like this. So thanks a lot, everyone. Have a good weekend.
Thank you, Raja. Thank you for
Okay.
the. Thank you,
Bye bye.
everyone. Thank you. Take care. Bye.